Dr. Bebat here. Let's do our medical word of the day. Today I've got sort of a weird one, and that is Takotsubo cardiomyopathy. It's also known as the broken heart syndrome. Um, Takotsubo cardiomyopathy occurs with instances of severe stress, either emotional stress or physical stress. It most commonly occurs in women about 90% of the time, usually menopausal women over the age of 50. This leads people to think that perhaps the loss of estrogen um, takes away the heart's ability to protect itself from stress hormones. That's just a theory. Takotsubo cardiomyopathy is a weakness in one area of the heart, and it's usually compensated by an overcontraction in other areas of the heart. For example, if the middle part of the lower chambers of your heart, your ventricles or the left ventricle, suddenly gets weak, the other parts can contract stronger and it forms what looks like a band around that area. There are four kinds of Takotsubo that's not really that important. You can have a lower end of the heart, middle, upper, or a spot defect. The symptoms are the same as you're having a heart attack. You're emotionally upset. All of a sudden, you have severe chest pain. Your heart's not pumping right. You may have arrhythmias. In severe cases, you can develop excess fluid buildup, pass out, faint. In the emergency room, it's difficult or almost impossible to diagnose this. It looks almost exactly like an acute myocardial infarction or a heart attack. And the actual diagnosis comes a little later, but treatment is going to be the same. Supportive treatment, anticoagulation treatment, medicines to slow your heart rate down. Typical treatment for a heart attack in the emergency room. The good news is there's usually no lasting damage. There's no blood vessel blockage. There's no death of cell tissue in the heart. And most people have a complete recovery with appropriate treatment. So there you have a weird cardiology thing, Takotsubo cardiomyopathy or the broken heart syndrome. If you have chest pain, go get it looked at.